In ancient civilizations, humans began learning how to care for one another by observing animals. We learned how to lick and clean wounds from canines and felines. From apes, we learned how to apply pressure to control bleeding. And from birds, we learned how to wrap wounds. Egypt contains the oldest written medical records dating back to about 3000 BCE. There were two branches of medicine, the theurgic class, which used magical cures, and the practitioners, who used natural cures such as herbs. In India, there were 4 different qualifications to becoming a nurse: the knowledge of drug preparation, cleverness, devotion to patients, and purity of body and mind. They were also the first to link hygiene to health. The people of Babylonia believed illness was a punishment for displeasing or sinning against the gods, and they used different methods to banish demons and avoid evil spirits. In 1900 BCE, Babylonia developed the first scale of fees for goods and services, but retribution was popular. If a surgeon performed an unsuccessful surgery, then he could have his hands cut off in penance. The Chinese were the ones to develop the concept of yin and yang and believed that health was the balance between these two forces. By 2000 BCE, the Chinese were using dissection, acupuncture, and herbal remedies and were the first to outline details of physical examinations. Hospitality was a sacred obligation in Greek culture. Large cities had specialized homes which served as inns for strangers, the poor, and the sick, and temples served as places for surgeries to be performed. However, the Greeks believed that the states of birth and death were permanent pollutions, and so pregnant mothers were shunned from places of hospitality, and the terminally ill were left to die in the streets. Romans believed lost health could only be restored by the gods, until they were introduced to medicine by the Greeks around the 3rd century BCE. However, the best medicine was reserved for soldiers. The Teutons, Norsemen, and the Danish revered their wise women who were usually elders. Society began to believe that those who had special powers of healing were a connection to evil spirits and could use black magic. Healing women were the first to be seen as witches. In Rome, early deaconesses began to establish a system of visiting nurses and sometimes even brought the sickness into their own homes. Nursing was also seen as a proper penance for past sins and a solace to unhappy lives. Greece began enforcing strict cleanliness of bedclothes, powders on moist skin, and mouthwashes for those who could not drink. They also developed strategies for pain control. The first nursing uniforms were created in 1190 so that nurses would be recognized when out in public doing charitable tasks. Nuns also became distinguished for their academics and their services. Religious orders also became very popular. In 1212, the Catholic Church passed statutes to regulate nursing orders. This included that men and women took oaths of chastity, poverty, and obedience. Within 50 years, leaders became corrupt and nurses were demoralized. Many nurses left the monasteries and convents, taking whatever they could.
In the 16th century, during the Renaissance period, the hospital was temporarily removed from the church's jurisdiction as demanded by King Louis XII. In 1562, nurses were directed to wear a black dress with a white linen apron and unstarched white cap in order to avoid scandalous apparel in the profession. These regulations of dress were very strict. Hernan Cortez built the Hospital of Immaculate Conception in what is current Mexico City. It is believed this hospital was up and running by 1524, where the nursing staff primarily consisted of a religious brotherhood. The 1700s marked a time of the hospital reform movement. John Howard was primarily involved in this process and was focused on the idea of religious hospitals, as in his mind they were quiet, neat, and clean with patient hygiene and infection at close attention. Following Howard's death in 1790, Elizabeth Fry worked with women in prisons and assisted with infants after childbirth. She then recognized Kaiserwerth in Germany, which was a program for nurses in training. In 1821, Pastor Fliedner became the pastor of a poor congregation in Kaiserwerth, Germany, and founded a hospital. His wife helped tend to the sick and taught the probationers on the art of nursing in a theory and clinical form as we learn nursing today. The couple began the Protestant nursing sister movement. When finishing their education, they provided services to the prisoners and poor in their community. In the mid to late 19th century, district nursing became a part of the profession in the UK and increasingly began to spread. Because of the Melbourne District Nursing Society's commencement in 1885, Australia gained this new profession. The value of self-sacrifice became essential in this part of nursing, primarily due to the idea of nursing as philanthropic work.
In World War I, nurses began serving in the military by serving care to the armed forces. The skills that nurses possessed from World War I were easily transferable across the field. This started leading into the specialization of nurses such as nurse anesthesists. From the 1920s to 1930s, hospitals continued to expand and offer more patient beds and more complex procedures. Most graduate nurses in the mid-1900s went into private duty nursing, which was an unstable job, and this was expensive for patients. The hospitals relied on bedside care for patients to be done mostly by nursing students. As hospitals became the site for caring for the sick, nurses moved to the hospital along with the patients who could afford to have them care for them. In World War II, nurses continued to give excellent care to military members. Contributions were acknowledged as essential to victory. Nurses served under fire in field hospitals and evacuation hospitals, on hospital trains and hospital ships, and as flight nurses on medical transport planes. Nurses took on a heroic view. Congress passed the Bolton Act, which set up the Cadet Nurse Corps program. The U.S. government subsidized the education of nursing students who promised that following graduation, they would engage in essential military or civilian nursing for the duration of the war. The cadet nurses spent the last 6 months of their training assigned to civilian or military hospitals, which helped to alleviate the critical nursing shortage. Everyone, including nurses, celebrated the end of the war. In the mid-20th century, the nursing profession flourished and moved past racial segregation and towards equal opportunity for individuals. By the 1960s, there was more specializations in the field such as ICU, pediatrics, neonatal, and nurse practitioners. A debate began to arise about the education of nurses and where it should take place. They wanted to take nursing education out of the hospital setting and put them into a facility of higher education. By 1960, approximately 172 Bachelor's of Science programs were available. These experts believed bachelorate-educated nurses would be better prepared to care for the complex needs of late 20th century patients and would be able to take on more advanced roles in the delivery of healthcare. Others still believed that the hospital setting was the best place for nursing education. Then came the community college associate's degree program, which was a good middle ground and allowed nurses to gain the proper bedside patient care needed. Nursing shortages still appear throughout modern nursing. As the baby boomers are aging, it may put a stress on our healthcare and require increased amounts of nursing care.